It's Monday, September 26th. I'm going to try. I have my face from here to here. I had a lot of Novocaine. I'm in this with Northwell. It says post-operative instructions. Now, I had to go, when I was in my 20s, I went to the dentist for routine cleaning. Dentist tells me I need something called a root canal. I had no idea what that was, never heard of it. I wasn't in any pain, whatever. So the dentist takes my tooth that they're saying was rotten and cuts into it or drills into it so that now it needs some kind of prosthetic crown. And then they glued, so my two roots were there and a slight whatever. And then they glued this prosthetic onto it so it still had the appearance of a tooth. At some point, the crown, they call it, or the cap fell off. But the roots were still in there, along with this portion of the hollowed out tooth, or the portion of the tooth that was left. With these health things I've been going through, I thought it was a source or a potential reservoir for infection. So I called an oral surgeon and I wanted to have it removed because when I opened my mouth, I could look in, it looked black. So I made the appointment. Today was the day. I go in. There was a lot of cutting, a lot of digging. There were stitches. And then the dentist or the doctor sends me home and says just ice it and Tylenol or ibuprofen. They're the doctor. Who am I to question? If they think that this is going to not need pain medication, I was fine. I come home, and now it's a few hours later, and the Novocaine is starting to wear off. And it is it's the type of facial surgery that requires some form of pain relief, more than just an ibuprofen cutting it. So it's like this it's so I know that there was some kind of epidemic where there was an overprescribing of something, of pain medicine, for a while. But now it's like the retraction, and it's like swung too far the other way. I mean, it is so incredibly painful. So I checked with Lynn and Lou. I'm like, what do I do? And they're like, call the doctor and see if they'll call a prescription in for something. I'm like, before the rest of the Novocaine wears off, so I did. But now, of course, the Novocaine, or the whatever, the nerve blocker that they had put in the mandible area, is starting to recede. And it is one of those, like, just even laying still, it is so whatever. So I called it in. Now I'm just waiting for a phone call back to see if they'll honor it. But it's one of these issues. It's a personal issue, but it's caught between this larger, grander fight of God blessed with some of these procedures, granted, there's a population that takes it and abuses it, but it's the same thing between prescribers and the population. But when you use it, when you need it, it really is a blessing to have access to it when it's something so serious as like a reservoir of infection. It could give you kidney infections, could give you heart, and so on and so forth. So now I'm stuck in this. Then there's this stigma attached to it. Like Lou and I had a fight not too long ago about being in a car accident in 2008 and taking pain medication. And I'm like, it's 2022 and I don't take pain medication, Lewis. I was like, what are you even intimating? I was like, you had a heart attack. They cracked your chest open. They gave you pain meds. Am I to call you a drug addict now and give you that stigma? That's the most ridiculous argument I ever heard. So, in a minimalist approach, um, it's not just like a tooth extraction. It's they dug deep for, there was a blade, there was having to push down a lot in order to rip out roots. There were stitches, lots of stitches. And then now there's a little slight swelling, but more so it's the pain. So this is this. I mean, like, I really feel like I'm caught in this area, like, damned if you do and damned if you don't for some reason. It's like, where's that brother looking over the bassinet of the American child delivered in 1978, where he was actually excited to have the sibling arrive, especially since the sibling had the special child that was anticipated. Not that that's gone well either, but it's so horrible. In this, like, just the way it's been executively directed for my particular situation. It's star one. So now I'm waiting on this doctor to hope that they finish up with whatever, whomever else they're working on, and that they get back to me before the rest of the nerve blocker wears off. It's star 1978, star 8378, Nicole, Cattaruzza. It's Earth, solar system, Milky Way, universe, galaxy is broken, and it's Bayside Station, Bayside, New York, 11361.